topic for today is about the grid. So these are our following objectives. That is to define what is a grid, identify its purpose in terms of imaging, enumerate the different types of grids, and enumerate the different types of grid errors. So what is a grid? It is a device which is used to improve the contrast of your radiographic image. Now, in what way do you think it can improve the contrast of your radiographic image? By absorbing the scattered radiation that is produced. So when X-rays pass through the body, one of these three things will occur. With your primary photons that originated from your X-ray tube. It's either it will pass through the body, the photons here will pass through this body unaffected. Second is it will be absorbed by the body. And third is it will interact with this body and it will change in its direction. So the photons that pass through the body unaffected will interact with your image receptor, which is here. And it will create your radiographic image. Now these differences exist because some photons pass through the body while other photons are absorbed. Primary radiation that interacts, and as a result of this interaction, it changes direction. And it is known as your scatter radiation. Because it's like this, guys. X-rays are produced here, right? So this is your photon. Let's just say. Photon is produced. And then you have an anatomy here. Let's say liver. Goes inside or goes this way. Goes to the liver. Gets that information. And then it has sufficient energy to reach your image receptor. And that information is going to be registered on your image receptor, which is your X-ray cassette, which contains your X-ray film. Now, second scenario. Photon is produced, goes here inside the patient's body, and then it goes to that anatomy, gets information, but changes in direction. But it has sufficient energy to register on your image receptor. Now, since these photons change in direction, they are no longer able to record exposure on the image receptor that relates to the patient's anatomy. Like our previous example, which is the liver. Now, the scattered photons, guys, will add an overall darkening or density to the receptor. Because like what we've said, even if it changed in direction, it has still enough energy to reach the image receptor. If that will happen, it will add an overall density or darkening to the image receptor. And as a result, there will be overall graying or darkening of your image. And contrast, guys, will be lowered. Can you see the effect? That is why you need a grid for this, because the grid can absorb the scatter radiation that is produced, right? Because if there is a grid before the image receptor, it will absorb the scattered radiation. Therefore, your contrast will be improved. Are we clear? So the scatter increases with increases in the volume of tissue irradiated and decreases with increased atomic number of the tissue. Why? We've talked about this. Increased atomic number. What type of interaction increases with increased atomic number of the tissue? For example, let's compare soft tissue to the bone. That's 7 versus 14. So there is an increase in atomic number, right? Scatter decreases here with increased atomic number. So from here, soft tissue to the bone, there is a decrease in scatter radiation produced because of the increase in atomic number. Do you know what's the reason for it? Maybe some of you answered, because if there is an increase in atomic number of the tissue, the interaction is going to be photoelectric interaction, right? As compared to your Compton interaction, because Compton interaction produces scattered radiation. Are we clear? The volume of tissue irradiated is controlled by the thickness of the patient and the exposure field size. But like what we've said, it is beyond our control. That's the patient's size or patient's body habitus and the exposure field size. Because like what we've tackled about, guys, you can't use the exact field size here for an x-ray of the abdomen if your patient's body habitus is this one. You have to adjust to include all of the anatomy needed for that particular examination. So the amount of scatter radiation, guys, increases with your increased patient thickness. It also increases with your larger field size, and scatter radiation also increases with a decrease in atomic number of the tissue. Why? It's because if it will decrease from bone to soft tissue, what is the type of interaction that will most likely occur? It's the Compton interaction, right? And Compton interaction comes with a price, that is your scattered radiation. And scattered radiation decreases your contrast. So as a general rule, guys, when you talk about using the grid is employed when a body part or thickness exceeds 10 centimeters. That's approximately how many inches? Because 2.5 centimeters equals 1 inch. So 10 centimeters is equivalent to approximately 4 inches, right? And another rule is if we are going to use a KVP which is above 60. So you already know this one, right? This is a caliper. And you can use this one to measure the body size. So if this one here, it's more than 4 inches, then that's the time that we are going to employ a grid. So a grid is a thin, flat, rectangular device made by placing a series of radiopaque lead strips side by side, and separating the strips. So there is a separating between each strip by an interspace material. So you have your strip, lead strip, interspace material, lead strip, interspace material, lead strip. So where can we find them, sir? You can find them on your under your table, your X-ray table or radiographic table. And can you still recall when I told you that some of the grids has this example wherein the grid is going to be the casing of your cell phone and the cell phone is going to be your image receptor, because it looks like this. See? This is your grid. It's like a casing of your phone. You have your image receptor, which is your X-ray cassette, which contains the X-ray film, and then you place your image receptor on your grid. So it's now a portable gridded cassette. And another one. See? So the very first grid was made in 1913 by the American radiologist Gustav Bocchi. So this is him, guys, and it looks like a waffle maker. Can you see it? Let's try to zoom in. Okay, now that's the first grid, guys. Now Dr. Baki's first grid consisted of wide strips of lead spaced 2 centimeters apart. 2 centimeters apart and running in 2 directions. Look at the direction. It's one direction and then the other direction. Along the length of the image and across the grid. So guys, can you imagine guys if we're going to use this grid and let's take a radiographic examination of the chest, and then we will use this grid. It's thick, remember, it's a strip that is wide and it's made of lead, and then it will look like this on your radiographic image because it's wide. There you go. So, in 1920, Hollis Potter, who is a Chicago radiologist, he improved Dr. Baki's grid design. Why, sir? It's because if he will not improve it, guys, we will have all of this markings for all of our radiographic images. So that's why Hollis Potter improved that design. So, what did he do? This is him, Hollis Potter. He realigned the lead strips so that instead of 2 directions, which was like this, he realigned it in 1 direction. Made the lead strips thinner because the other one was thick and therefore less obvious in the image. And then designed a new device which is known as the Potter-Baki diaphragm, which allowed the grid to move during the exposure. So it looks like this. Thinner, 1 direction, less obvious in your radiographic image. So what about the grid construction? It involves the selection of materials, the grid ratio, and the grid frequency. So let's talk about the grid materials first. So a grid is a series of radiopaque strips. Radiopaque, it will appear white, right, on your radiographic image. Radiolucent, it will appear dark. So radiopaque strips which alternate with radiolucent interspaced material. So you have your lead strips here. Interspaced material, lead strip, interspaced material, lead strip, interspaced material, lead strip, so on and so forth. Now the interspaced material, guys, is radiolucent. It can either be made up of aluminum, which is commonly used since it is easier to manufacture, it is durable, and it has a high atomic number. And the other material aside from aluminum, which is used for your interspaced material of your grid, is fiber. Now, the aluminum, guys, has a higher atomic number than fiber, and it can provide an additional absorption of your low energy scatter. So this is just a little visual to help us about radio opacity and radiolucency. Try to look at the image. Radiopaque, bone, white. Metal is very opaque, it's really white. Gas, radiolucent, it appeared dark. Aluminum has a higher atomic number. And because of its higher atomic number, guys, it can increase the absorption of the primary photons. And that is a disadvantage. Why? Because there are certain examinations wherein we need to use low KVP. KVP has something to do with how penetrating it is, right? So can you imagine, guys, if we're going to use low KVP techniques? KVP can affect the quality and quantity of your X-rays, right? MAS affects the quantity. So for example, we have a radiographic examination. We are going to use a low KVP technique for that. So these are the X-rays that are produced during this examination. Now, this is your image receptor here. Where are we going to place our grid? Above or under the image receptor? It's above, right? So this is your image receptor. This is where we are going to place our grid. What if that grid has an interspace material made of aluminum? Because of the high atomic number of that interspace material, which is aluminum, it is going to absorb more of the primary photons, which means to say, guys, before it reaches the image receptor, there will be less photons. That's why what will happen to the exposure to the image receptor or image receptor exposure, will it increase or will it decrease? It will decrease because the aluminum of the interspace material of that grid, especially for low KVP techniques, will just absorb the primary photons before it reaches your X-ray cassette. So what about the grid ratio? The grid ratio is the ratio of the height of the lead strips and the distance between each strip. So let's say this is your lead, and then let's take this one here, we will place it here. Okay. So it is the ratio between the height of the lead strips and the distance. So it's ratio between the height and the distance. Are we clear? Ratio between the height and the distance. Height, distance. Height, distance. Height, distance. So on and so forth, guys. Remember, if the height is constant, or if the height of the grid is constant, decreasing the distance between the strips would result in an increase in grid ratio. Once again, if the height is constant, just like this, height is constant, same height. Sorry. If the height is constant, guys, decreasing the distance between the strips, this one here, if we're going to decrease the distance, it will become like this. It's going to be narrower, right? If we go just as long as their height is constant, but we just decrease the distance, so it's narrower now between the strips, it will result in an increase in grid ratio. Are we clear? Next. But same, it's still the same, guys. Height is still constant, but this time what we're going to do is we are going to increase the distance. So from this, it becomes like this, it becomes like this. Okay? From this one, guys, the height, from this to this, it's constant. But the distance is more wider. From this strip to this strip, it's now wider. From this strip to this strip, it's now wider. It will result in a decrease in grid ratio. Are we clear? That's why there is an inverse relationship that exists between the distance of the lead strips and grid ratio, just as long as the height of the grid strips remain the same. Right? The relationship is inversely proportional. Okay, bear that in mind, guys. Now, for higher grid ratios, it allowed less scatter radiation to pass through the interspace material. Why, sir? Try to look at this one. What if you have your scatter radiation here? It's a high ratio, right? High grid ratio. Interspace material, and then you have your image receptor here. Can you imagine? Interspace material. Remember, scatter radiation, if it reaches your image receptor, it can decrease the contrast, right? So we need to eliminate the scatter radiation. So if you are using a grid that has a high grid ratio, so it would look like this. Scatter radiation can be absorbed here. Scatter radiation can be absorbed here. Scatter radiation can be absorbed here because it has a high grid ratio. What about a lower grid ratio? There. Oh, there you go. Image receptor, lower grid ratio. Scatter radiation. Since there is a wider space between each strip, there's a possibility, guys, that this scatter radiation can pass through that space between each strip. And that scatter radiation can register its information or can go to your image receptor. It can reach your image receptor. And therefore, what will happen to the contrast of your radiographic image for this examination? It will decrease. So which one, guys, do you think is better? A high grid ratio or a lower grid ratio? High grid ratios are more effective at removing scatter, obviously, because you have more lead strips to catch or to stop or to absorb your scatter radiation as compared to your lower grid ratio. Grid frequency is defined as the number of grid lines per inch or centimeter. And grids are made with a range in frequency from 60 to 200 lines per inch. Now, most commonly used grids have a frequency of 85 to 103 lines per inch. So just imagine this is 1 inch. Now, most commonly used grids, guys, will have a frequency of, this one here is between 85 to 103 lines, that's per inch. We also have very high frequency grids. Very high frequency grids will have an approximate of 103 to 300 lines per inch, and these are recommended for stationary grids, which are used with your digital image receptor systems in order to reduce the possibility of seeing the grid lines on the image. In general, lead content is greater in a grid that has a higher grid ratio. Because as you can see, guys, you have a lot lead content here as compared to your lower grid frequency. As the lead content of a grid increases, the ability to remove scatter radiation and improve contrast will also increase. And then we have different grid patterns. Grid with lead strips running only in one direction are called linear grids. So this is an example of a linear grid, one direction only. But if we're going to place two linear grids in opposite direction, first direction, another linear grid on top of this one, but in an opposite direction. So, like this, these are linear grids placed on top of each other in opposite directions. It is now called your crisscross or your crosshatch. So this is the view on top. So if you have your grid, so it's like this. What about, let's try to look at the crisscross or crosshatched grid from the side. So it would look like this. Parallel, one direction, linear grid, one direction. Place another linear grid on top of it, but on a different direction. Now you have your crisscross or crosshatch. Now for linear grids, guys, these are commonly used in clinical practice because they can be used when performing procedures that require angulation. What is angulation, guys? Angulation is, you have your collimator, right? Your collimator can be angulate to certain positions. For example, this one, you can angulate your collimator to this position, You can angulate it like this. You can even angulate this one like this. That is angulation. And this one, guys, is the long axis of your radiographic table. This one, obviously, not the long axis. The long axis is this one here. So you can angulate your X-ray tube to the long axis, right? But, can you see this one? See? If you're going to angulate, this one also changes. But angulation, guys, across the long axis of the table would also result in the primary beam being directed into your lead strips. Try to look at this one. There's a possibility that by angulating, instead of passing through the interspace material between each strip, the direction now can hit your lead strip. So what do you think will happen if this one will occur? What do you think will happen to the exposure of your image receptor? Do you think it will increase or decrease? It will decrease, because instead of passing through the interspace material, if you're going to angulate it, it will now hit the lead strip, right? Therefore, if it will hit the lead strip, it will not go to your image receptor. So the exposure to your image receptor will be decreased. The grid cutoff is a result if the primary beam is angled into the lead, and the lead will absorb an undesirable amount of that primary radiation. So this is how it will look like, guys, on your radiographic image. Try to look at this. Can you see? Instead that there is a structure here and here, it is now cut off because of that angulation. You have different grid types. You have first the parallel grid. Parallel grids are made with the lead and interspace strips running parallel to one another. So as you can see, this is your X-ray tube. These are your X-ray photons, right? Your X-ray photons does not come out in this direction. It comes out like this in a fan shape. See? Parallel. Lead strips, interspace material in a parallel direction. Next grid type, focus grid. Try to look at the difference. Focus grid, focus grid. These are designed so that the central grid are more parallel. So central, this is the central grid. So more parallel, straight, right? But as the strips going to the peripheral side, this one here, left side, right side, as they move away from the central axis, they are more and more inclined. Try to look at this. This is the center, so parallel, but as they move towards the sides, they are more inclined. Right. And then try to look at the direction of your X-ray photons. Now, if these lead strips were extended, the strips would intersect along a line in space, which is known as your convergence line. And the distance from the face of the grid to the points of the convergence of the lead strips is called as your grid ratio. So for your convergence line, guys, it's this one. This is your focused grid, right? Try to look at this one. This is your convergence or your convergent line. Okay. And then, this is the side, right? Are we clear? What if we are going to look at this grid from this direction? So if you're looking in this direction, guys, just imagine that this is the face of the grid, not the side. So from this, you will be facing the grid in this direction. So, if it's now here, you will be able to see this one here. It's called your grid radius. Okay? Are we clear, guys? So from this direction, we are going to look at the grid in this manner. So for me, it's like this. For you, it's like this. Now you will be able to see this one now from that point of view, and it's called your grid radius. Now, for the grid to be properly focused, guys, because maybe some of you are saying that focus grids are better because of the convergence of the beam, because the beam from the X-ray tube is not in this line, it converges in this direction, right? So maybe some of you would say that yes, I think that focus grid is much better because of the natural convergence of the X-ray photon. But for that grid to be properly focused, the X-ray tube must be located along the convergent line. So try to look at this one, guys. I've said, this is your convergent line. The X-ray tube must be located, the distance from the X-ray tube should be here, exactly at the convergent line, because this is your grid. This is your X-ray tube where the X-rays are created, right? So your X-ray tube, if you're going to use a focus grid, your X-ray tube should be at your convergent line. In order for that grid, which is your focus grid, to be properly focused, so that it would look like this. Okay? It will not extend outside its grid ratio. Grid radius, I'm sorry. It will not extend outside the grid radius. Focus grids with lower grid ratios. What is lower grid ratios again? Like that. Right? This one, high. Okay? Focus grids with lower grid ratios allow for greater latitude in the alignment of the tube with the grid. Why, sir? It's because try to look at the distance. So you have a greater latitude because of the distance between each lead strip compared to this one. Right? But if we're going to use a higher grid ratio, a proper alignment of the grid with the tube is more critical. Because why, guys? Try to look at the number of lead strips for a higher grid ratio. There's a possibility that if you are not going to follow the convergent point, wherein the X-ray tube should be located here at the convergent point for a focus grid, there's a possibility that the X-rays that will be created during that exposure will just simply hit the lead strips. Because remember, this is a high grid ratio, you have a lot of lead strips as compared to this one. That's why the distance of the or placement of your X-ray tube for this one is critical. Parallel grids are less commonly employed than focus grids because the strips do not coincide with the divergence of the beam. Some grid cut-off will occur along the lateral edges, especially when the grid is employed at shorter source to image receptor distance. Are we clear, guys? Parallel grids. Try to look at this one. Parallel grids. This one, parallel, straight. are less commonly employed compared to your focus. As it goes to the sides, it becomes inclined. It's because of the divergence of your beam. Try to look at the divergence of the beam. So that's why, guys, some grid cut-off might occur on the lateral edges of your parallel as compared to your focus grid. Especially when the grid is employed at shorter source. What is your source? X-ray tube to image receptor distance. Okay? So source to image receptor distance, shorter. Let's make it shorter. It's like this. Okay? Longer like this. Decrease, increase distance. Decrease distance between the X-ray tube and your image receptor. Increase the distance between your X-ray tube and your image receptor. Now, what about grid uses? A grid is used either in a stationary position or mounted in a Potter-Bucky diaphragm to move it during exposure. Stationary grids are used primarily in portable procedures or for upright or horizontal beam projections. This design is called as your grid cassette. A grid cassette is usually employed, guys, for portable procedures. What do you mean, sir, portable? Which means you're going to bring your portable X-ray machine to a certain area in the hospital. It could be the room of the patient, it could be the emergency room, and you are going to do the procedure there. Because remember, the grid is also mounted under your radiographic table. So you cannot bring the entire radiographic equipment there, right? So you have to bring something else. So that's your portable X-ray machine. And then you have your gridded cassette or your portable gridded cassette or your grid cassette. And then you can perform the examination on that area. Just like this one. See? So this is your X-ray tube here. Instead, the X-ray tube is in this position. The X-ray tube is here. Right? You can see your central ray here. So you already know for a fact that this one here is in this position and not in this position because of the appearance of your central ray. So obviously, X-rays will come out here, go towards this area, get information, register that information on your grid cassette, which is placed here. Are we clear, guys? So that is one of the things that you can do during your portable radiography. The most common use of the grid is for procedures using the Potter-Bucky diaphragm, usually called the Bucky. It is a device which is mounted below the tabletop of the radiographic or X-ray table and holds the cassette in place below the grid. So these grids are approximately 17 inches by 19 inches and large enough to cover a 14 by 17 inches size of cassette. Because we have different sizes of cassette, right? This one, guys, is an 11 by 14. This is not the largest that we have. We have the largest, which is 14 by 17, which we will use to place our X-ray film, which is also 14 by 70. Because you cannot place this one here. Can you see it? Because the image receptor is smaller. For this one, this is 11 by 14. Cassette placed either lengthwise or crosswise in the cassette tray, which is located under your X-ray table or radiographic table. The lead strips of the grid run along the long axis of the table. So you already know what is the long axis of your radiographic or X-ray table, right? So the long axis is this one. So the lead strips of the grid run along the long axis of your X-ray table. And in order to blur the headlines, the grid must move at a right angle to the direction of the line. So you already have an idea, guys, that this one, long axis, so we will zoom it in. It runs along the long axis. So you have your lead strips here. And it needs to blur the headlines. It needs to move at the right angle. So what do you think should be the movement here? Is it like this or like this? It's like this because that's the right angle here, right? The lead strips run along the long axis. So obviously the right angle of this one is going to be back and forth, back and forth. And there are two movement mechanisms which are used today. The movements are described as reciprocating and oscillating. For your reciprocating grid, a motor drives the grid back and forth. Because try to look at this one, guys. Like what we've said, this is the X-ray table. And then the grid will run along the line of the long axis of the X-ray table. So you have your grids here. So the movement should be right at the right angle. So it's not like this because this is the long axis. It needs to be like this. Are we clear, guys? So that movement can either be reciprocating or oscillating. So your reciprocating grid, there is a motor that drives the grid back and forth during the exposure, but the total distance will be no more than 2 to 3 centimeters. So the distance here, like this, will be no more between 2 to 3 centimeters, such as this one. Can you see it, guys? There you go. Can you see the movement? I'll try to zoom it in if it will move. The movement is supposed to be like this. I'll try to zoom it out and then try to look at the movement. There. Okay. Now the other movement, guys, is the oscillating grid, wherein there is an electromagnetic pulls. An electromagnet, pulls the grid to one side, just like maybe to this side here or to this side here of the table, but not here and here, but here or here, and then it will release during the exposure. So there is an electromagnet which pulls the grid to the side like this. Maybe this side of the table, and during exposure it will release. So right angle again, it will go like that. Right? Okay. Once a grid is selected, it is mounted into your Potter Bucky diaphragm. It is not easily changed. So that's why, guys, maybe in the near future, you are trying to contemplate on creating your own laboratory. So you need to purchase a radiographic unit, right? So in order for you to come up with certain decisions, especially with a grid selection, you have to consult with the department administrator together with the collaboration of the radiologist. So the more efficient a grid, guys, is at absorbing scatter, the less exposure will be received by your image receptor. Can you imagine this one, guys? As much as possible, we need to eliminate or significantly reduce scatter radiation, right? That will reach your image receptor. Because if more scatter radiation will reach your image receptor, what will happen to your contrast? It will decrease, right? That's why we need to use grids. But the more efficient the grid that you are using is at absorbing scatter radiation, guys, the less exposure will be received by your image receptor. And we need enough exposure to your image receptor to have an acceptable radiographic image, right? That's why, guys, if we're going to use grids, compensations again must be made to increase the exposure, that your image receptor needs. And what do you think is that? What do you think? Do you think by increasing the KVP will compensate for the decrease in the exposure of your image receptor? Or do you think you need to increase your MAS to compensate for the decrease of the exposure of your image receptor because of the use of the grid? What do you think, guys? Do you think you need it more penetrating, or do you think you need to increase the amount of X-rays created? It's MAS. So you need to increase your MAS to compensate. But there is another disadvantage. That is going to increase also your patient dose, right? Because you need more X-rays. X-rays create the image, right? But if you're going to use grids, it can decrease the amount of exposure to your image receptor because it can absorb the X-ray photons, remember? And because of that, you need more to create. You need more X-rays to create an image. So that's why you need to increase your MAS. But in doing so, we are also increasing the patient dose. The better the grid cleans up scatter, the greater will be the dose given to the patient to achieve an adequate exposure. Can you see the difference, guys? Less contrast because this is without the grid. Increased contrast because we used a grid here. Let's compare the two. Sorry. Without the grid, with grid. Try to look at the contrast. See? See? Without the grid, decreased contrast. With grid, increased contrast. Now, grid performance evaluation. The efficiency of a grid in cleaning up or removing scatter can be quantitatively measured. So the ICRU, or the International Commission on Radiologic Units and Measurements, Handbook 89 defines two criteria in order to measure the grid's performance. These two criteria are your selectivity and contrast improvement ability. Now, selectivity, although grids are designed to absorb scatter, they also absorb primary radiation. That's why, guys, that grids that absorb a greater percentage of scatter than primary radiation are described as having a greater degree of selectivity because it selected to absorb a higher percentage of the scatter as compared to the absorption of primary radiation. The greater the grid is at removing scatter, the greater will be the selectivity of that grid. This means that a grid with a higher lead content would have a greater selectivity. The second criteria, guys, contrast improvement factor. The best measure of how well a grid functions is its ability to improve contrast, especially in the clinical setting. It is dependent on the amount of scatter produced, which is controlled by your KVP and your volume of tissue irradiated. Why KVP, sir? Because when we increase KVP, the type of interaction that will occur is going to be Compton interaction. And Compton interaction will produce scatter radiation. That's why it is dependent on the amount of scatter produced, which is controlled by your KVP, and the other one is the volume of tissue irradiated. As the amount of scatter radiation increases, the lower will be the contrast and the lower the contrast improvement factor, right? As the amount of scatter radiation increases, so there is an increase in your scatter radiation, the lower will be the contrast, and the lower will be the contrast improvement factor. Just like this one. Which one has a better contrast, guys? Left or right? Try to look at this area here. Compare. See? This one has a better contrast. You also have grid errors. Poor images can result from improper use of grid. Although, if we're going to use grid, it can reduce the scatter radiation by absorbing it or eliminating it, guys. Therefore, it will increase the contrast on that radiographic image. But poor images can also result if you don't know how to use the grid. An example of that image would be this one. That is not the type of radiographic image that we want to present to the radiologist, right? For diagnostic purposes. First one is your off level. This one will occur when the tube is angled along across the long axis of the grid strips. So try to look at that one. See? Off level. And then what about the image, sir? If it's an off level, guys, you will have this image. So do you think it has good quality? Do you think this can provide diagnostic value to the reader or to the radiologist? Alright. So an off-level grid can occur with a focused grid, and it is the only positioning error possible with a parallel grid. With what we've said, it can result to this type of radiographic image. Now, aside from off-level, you also have your off-center. Off-center, guys. The X-ray tube must be centered along the central axis of the focused grid in order to prevent an off-center or off-axis, or sometimes called off-axis or lateral decentering grid error. Centered, right? If it's a focused grid, it is more inclined as it goes towards the side. So an off-center would be from this one to this. Can you see? Alright. The result is a decrease in exposure across the entire image. Try to look at this one, guys. Like what we've said, if we're going to use a focused grid, the X-ray tube must be at the convergence line. Because you have here your grid ratio, grid radius, I'm sorry. You have here your grid radius, right? If we're going to look at it from this view. Now, the greater the degree of lateral decentering, the greater will be the grid cutoff. And then it will result in a decrease in exposure across the entire image. So can you see this one? Decrease in exposure across the entire image. You cannot even see certain parts of the skull. Next one, guys, is your off focus. An off focus grid is made to be used at very specific distances as identified by your focal range labeled on the front of the grid. So you need to have your focal range. Try to look at this one. The distance between this and this. And then the distance between this and this. So your grid will have a focal range which is labeled on its front. And you need to follow that distance or else you will have an off-focus grid. An off-focus errors result in a grid cutoff along the peripheral. When I say here, do you think it's correct? When we talk about peripheral? No, because this is the central. Peripheral is this and this. Right? So an off-focus error will result in a grid cut-off along the peripheral edges of your image. Just like this. Peripheral edges. Sides. Another one, guys, is your upside down. An upside down, it's a focus grid has an identified true side based on the way the grid strips are angled. If the grid is used upside down, severe peripheral grid cut-off will occur. Try to look at this one. You have your focus grids, right? Can you imagine, guys, if you are going to have an upside down? So this one will be changed. It will now look like this. This one here. From this to this. And it will result to a severe peripheral cut off of your image. Try to look at this one. And then you have your Moiré effect. This is a grid error that occurs with digital image receptor systems when the grid lines are captured and scanned parallel to the scan lines in the imaging plate reader. So this is an example of your Moiré effect. So what about, sir, in terms of its appearance when it is captured? So it would look like this. It will render like this on your radiographic image, on your image. But remember, this occurs with digital image receptor systems. Sir, is there an alternate way to reduce the scatter radiation produced? Yes, guys, there is. Because like what we've said, in order to reduce the scatter radiation, we need proper beam restriction. That was our previous discussion. And now we're talking about grids. But is there another way? There is. It's called an air gap technique. This is best done by restricting your primary beam. What is an air gap technique? Air gap technique is simply this one, guys. X-ray source, you have your X-rays, you have your patient. You have your image receptor here. Try to look at the distance. This is your air gap. Because for example, this is a chest X-ray, right? We usually do this all the time. Image receptor, it needs to be closest to the anatomy of interest. So for this one, if it's chest, the image receptor here should be like this. But if we're going to use an air gap technique, which is another alternative method of reducing scatter radiation, you are going to increase the distance between your object and the image receptor. So increasing the distance would be between me as the object and your image receptor. So increase OID. Increase OID. So distance between the object and image receptor. So this here is your air gap. So this one here, guys, is another way of reducing scatter. Why? Because what if the scatter radiation is here? And then it will stop here. See? So that's another way of reducing scatter radiation, the amount of scatter radiation, because of the air gap technique. See? What if the scatter radiation that is produced during this examination will just reach here because of the distance? It will not go towards your image receptor anymore. It will not reach your image receptor. So if you want to, as much as possible to really decrease the number of scatter radiation that will reach your image receptor, you have to increase this one. Are we clear? Because scatter, what if you increase it more, will just stop here. It will not reach your image receptor. Alright, sir. So, an air gap technique is an alternative to use of a grid. It has primary applications in magnification, radiography, and to a lesser extent in chest radiography. So the technique involves placing the patient at a greater object to image receptor distance, like what we've talked about, thus creating an air gap between the patient and the image receptor. So while the same amount of scatter will be created, guys, during that exposure, less of the scatter will now reach your image receptor, especially if the patient or if the image receptor will be moved away from each other. But guys, there is a disadvantage here. I mean, if you're going to look at it from this point of view, scatter here, right? So the more you increase the distance between the object and the image receptor, the less scatter radiation, the less amount of scatter radiation will reach here, right? So maybe at the back of your mind, you're thinking, so it's better to increase the distance between the object and the image receptor by doing like this. But there is a disadvantage, guys. The disadvantage of using your air gap technique is loss of sharpness because of the increase in the object to image receptor distance. What do you mean, sir? Try to look at this one. By using, this is the actual radiographic image for this specific examination. Okay? For example, this one is this area here, right? What if we're going to take another examination of the same area, but for this one, guys, it's supposed to look like this. See? But we're going to use the air gap technique. So we will expose it looking like this because we want to make sure that the amount of scatter radiation that will reach your image receptor will be reduced because of the distance, right? But if we're going to do that from this actual radiographic image, it can become this. There you go, guys. So can you see it is magnified? Yes, you can say that the contrast might increase, or the contrast will increase rather, the contrast will increase because by doing the air gap technique, the amount of scatter radiation reaching your image receptor is reduced, right? But disadvantage, there is a loss of sharpness. Try to look at this one. The image is now magnified. So that concludes our discussion for the grid, and I do hope you've learned something from me today.